Any project we take on will be heavily de-risked, meaning we do the due diligence just like we do in the cardiac surgical operating rooms or writing a scientific paper. We do the underwriting with experts and ensure that we're not over engineering a deal, but we're actually writing it very conservatively, just as we would be in treating a human being.
All right, everybody, welcome back to the show, Action Takers Unscripted. Again, we have another incredible episode for you. I'm glad that I have Dr. Rakesh here to share his story and share some insights. He's going to be unique because he is a heart surgeon and he has been creating businesses based on medicine, based on his profession, and it's going to be very unique. So if you want to hear an incredible story, just stay tuned. And without further ado, I'll go ahead and let Dr. Rakesh share your journey, share how you what you do in this in your business, and we can go ahead and move on from there.
Well, Arsenio, it's a great pleasure to be here with you. I've listened to your podcast. I'm so impressed about the breadth of the subject matter that you address and how you have this way of teasing out people's unique messages through their story. So just thrilled to be on this with you.
Thank you very much. I appreciate you. Why don't you go ahead and share just your journey and just get the audience to know a little bit about you.
Sounds good. So I'll start with the quick summary. So I'm a Canadian who became an American heart surgeon, became an innovator, became a leader, became a person who cares about building communities and legacies to leave for others. That's kind of my life story in a few words. But I was born in Canada, the son of immigrants, my father from India, my mother Ukrainian Canadian. And from a very early age, visiting the streets of New Delhi as a 3-year-old really sunk in my mind that there were great inequities in the world. And through that realization as a 3-year-old that there were children who didn't have what I had because of where they were born or the communities that they were a part of, it really set in me a passion that has carried me forth through my life in making a difference in the lives of others who may not have as much or may not have as much support to achieve their dreams. So that's truly been my mission through life, through growing up in central Canada at a small city called Winnipeg, to having been blessed with a scholarship to go to one of the foremost universities in Canada, Queen's University, where Elon Musk was actually a year apart from me. I still remember him running around the streets of Kingston, Ontario,
Oh, that's awesome.
to be receiving an award to go to the University of Toronto, a globally recognized medical school that really opened my eyes to how, as a doctor, we could make an impact in the world on so many levels, and we can talk about that. To then being blessed to have the invitation to come to Oxford University to study amongst the world's most innovative and scientifically renowned inventors and scientists and clinicians to study transplantation. Back to Toronto to finish general surgery, on to heart surgery, to the Mayo Clinic to finish my training in heart surgery. Fortunate enough to be invited on the staff there, where I developed a subspecialty in mitral valve repair of a very complex valve, one of 4 valves in the human heart that very few people in the world were tackling at that point, to building the team to introduce robotic heart surgery to the Mayo Clinic, to then leading that from the Mayo Clinic across the 3 campuses. And that's when really I mean, they're all opportunities. They all pushed me to be better than I thought I could be because of the remarkable people that I worked with and the platform upon which I stood. But when it came to the Cleveland Clinic, in particular, the CEO of the Cleveland Clinic, Toby Cosgrove, inviting me to be a part of a paradigm that was absolutely historic and game-changing. That was to start the world's first U.S. academic medical center ever created from ground up to emulate a parent organization in the U.S., outside the U.S., it was an opportunity that I just couldn't turn down. In fact, the vision of it, even before I traveled to Abu Dhabi, reminded me of that moment on the streets of New Delhi when I was 3 years old, and that I felt the core of my being that this was an opportunity to make good on that promise I made to myself so many decades previously, that I was going to do everything I could to make a difference in the lives of others. So fast forward 7 years, a growth of the staff from a couple hundred to over 6,000, creation of 7 centers of excellence, academics, teaching, research, innovation. Now we're really humbled to say that Cleveland Clinic in Abu Dhabi is on the world's shortlist of globally recognized academic medical centers, and the leaders that we've all recruited have been better than us, and they've taken it to the next level. And that's a really good thing that we can talk about, is how you recruit great leaders to take the business and the mission to the next level.
Mm.
So returning, I really had a little bit of a moment to think about what was next. I continued to do heart surgery. That's kind of my charity, my philanthropy to humanity on a day-to-day, person-to-person level, and I'll never give that up. To helping others in leadership, grooming and mentoring leaders, and helping transform healthcare systems, and we can talk about that, to developing an entrepreneurial side. And you might ask, well, why real estate? And I'm sure we'll get into it. And the mission of our company that we founded, Titan 3 Capital, the mission is very simply to build communities worth living in and to leave legacies worth leaving. And fundamentally, it's to support people who live, work, play, study, and contribute for their whole lives right next to academic medical centers, but don't have places to live. So this is where we're creating communities around academic medical centers, so they're not something to be run away from, but actually neighborhoods and communities that we can embrace and grow and invest in.
Yeah. You share an incredible story just from what you saw when you was in Abu Dhabi as a young boy, and just what really introduced you to being passionate and helping and wanted to provide and help others. You saw others struggling. You see others, um, you know, not having the same opportunities that you or I or other individuals have. And I think that just opens up a new perspective of what you can do to help others. And I'm a big component of helping other individuals as well, especially if they're in a position where they're struggling, and or I share my story. I share some of the experiences that I have in order to get them to uh, a, a a certain point in their life, and that's kind of where I am in the Marine Corps. Is as we had a little bit of a discussion of where I'm at now, I'm in a position to advise, to coach, to mentor, to guide these young Marines to become better leaders for tomorrow. Uh, and I see that's what you do in the medical field as well. So, one, again, glad to have you on, and I'm glad you shared your story. I want to go back into, you talked about a little bit about your medical practice and your medical field, but going back to your inspiration to becoming a heart surgeon, can you share like what made you passionate or made you pursue the being a heart surgeon, and what was the inspiration for that?
No, thank you. So at the University of Toronto, as one of the foremost centers in the world where heart surgery was really started in the early days and advanced, and one of my early days in medical school, I had the opportunity to walk into a heart surgery operating room. And what I saw really changed my perception of the opportunity and the ability to change someone's life. There's many ways we can help someone in life. One's medically, financially, educationally, et cetera. But what I saw was a patient suffering with heart failure. And for those of you who don't know what that is, that's basically a person who can't get out of a chair or a bed. Their heart's just not able to pump enough blood to support the brain and all of the organs in the body. And what I saw is, through a simple 3 to 5 hour operation, that person's life was forever changed for the better. Meaning, after the recovery, a few days in hospital and on to home where they would get on their feet, they were literally a changed person for the rest of their life in some circumstances. And this was something that I couldn't ever have imagined would have existed before I saw an open heart surgery at the University of Toronto by one of the world's foremost heart surgeons. And at that moment, it made me appreciate it was that type of impact that I wanted to have in the world. So then you set your sights on becoming that or developing that capability. You say, "Gosh, well, what does it take?" Well, here's what it takes. It takes being at the top of your medical school class, and then being invited to become a general surgeon. And then once you're a general surgeon, then you're invited to become a heart and lung surgeon. And then you're invited to become a heart surgeon. And then you're invited to subspecialize in the valve micro repair work that's necessary to artistically recreate the mitral valve. So, net, what this looked like, Arsenio, was a training career that started at 17 years of age, coming out of high school and entering university, to my first job at the Mayo Clinic on staff at the age of 36 years old. So
Mm.
it was a long, hard road, but through that, I really developed an ongoing reaffirmation every day that this hard work, this sacrifice, these hours of foregoing personal pleasantries and socialization and trips and all the things that my colleagues were doing during those years between your teens and your 30s, delaying gratification and really striving to be the best for your patients so you could save lives in a way that just didn't exist elsewhere was something that I wanted to devote my life to. So that was my journey between 17 years of age and 36 years of age. And the learning never stops, Arsenio.
Oh
I'm
yeah.
still learning to this day.
Yeah, same here, same here. You think you know everything, and then voila, something new comes up, and then it's like, oh, I can learn a little bit more, and I don't know as much as I thought I knew. So it's always a learning experience in this life, and in your profession, I'm sure. And it's not something that you can just research on YouTube and and just absolutely know everything and every skill there is to becoming a heart surgeon. But yes, incredible journey, incredible story. I think I want to transition into you. You started. Uh, you was a heart surgeon. You shared your story and your inspiration in regards to that, but you also was studying. You was practicing medicine, and then you transitioned to becoming leadership within the health care industry. Um, let's. What was your motivation from transitioning to from the medical practicing medicine to your leadership development skills or leadership development within the healthcare industry?
Yeah. So leadership is the same in principle, whether you're on the little league soccer field or on the football team or at summer camp, where I really started my appreciation of what it was to be a leader by watching others as a 14-year-old at summer camp, going to leader and training programs to being on a canoe trip in the wild woods of northern Canada to then functioning on a team in a medical school, in a general surgery team, in a heart surgery team. And here's what it boils down to. And it's the same when you're a CEO of a large multinational healthcare organization. You need to establish a vision and a vision that accomplishes something of meaning. And once the vision is there and the vision aligns with the necessary stakeholders, then you need to develop the team around it to co-create that vision and flesh it out and make sure that it's robust enough and meaningful enough and achievable enough. And then place the around it the strategy, how you're going to articulate and achieve that vision, the strategy, the tools, the tactics, the transparency of the data and how you're doing, and the accountability. So from vision to strategy to tactics to team to accountability, it's the same whether you're on a soccer field or in a general surgery operating room or in a boardroom in the middle of Abu Dhabi. It's fundamentally the same. And how does one get there? And I think many of your listeners may be saying, well, could I do that? And the answer is absolutely yes. It takes a deep level of humility, a commitment to making a difference, accountability, hard work, collaboration, teamwork, and always being willing to admit that you've made a mistake, that you don't know the answer, and asking for help from others. And that's one thing that, good or bad, I've done my whole life is I ask for help and advice from others because most days I don't know what the right thing to do is. And that may sound shocking to your audience, but when let's just think about what we're talking about here. We're talking about healthcare leadership. So how would any leader know how to tackle COVID? And we were
Mhm.
the first US academic medical center to tackle COVID, being in Abu Dhabi, where planes were last landing from COVID hot areas long before they were landing in the UK or the US or Canada. So the only way we handled that as a leadership team was to be humble enough to ask for help. Ask for help from everybody in the organization, not only the leaders, but the frontline caregivers and our partners in the community, our stakeholders, whether they were government or sovereign wealth partners, et cetera. So ask for help, be humble, relentless passion for learning, growing, improving, and never accepting the status quo. Those are the sort of lessons that I would say are enduring in leadership, regardless of where you are or what industry you're in.
I think having humility, and just letting go of that pride, uh, especially for male figures, because we are very prideful individuals, and I think in as humans, we have a hard time asking for help sometimes. I'm not going to speak for everyone, but there are individuals who have issues asking for help when they need it. And then they either wait until the last minute and then it's too late. And it doesn't alleviate, it just adds more to a snowball effect where they're going downhill. And then again, like it is too late to ask for help, but you just gotta know, like there are other people who's been through the same situation or been through a similar situation or never been through a situation, but having that team, as you said, through COVID, no one knew what to do in that type of environment. It was a new pandemic, a new crisis. A lot of us just didn't know what was going on. It spread so fast and so quickly. But as you stated, you leaned on those individuals, those other leaders, the teammates around you, and you guys combined together and made a plan, visualized and made a strategy to overcome these obstacles. So yeah, COVID was definitely a challenging time. It's still some in some ways challenging in some areas, but we've made ways, we've adapted, we've overcame, and it's just been incredible what the human nature can do when we collaborate and work together as a team. Um,
And on that point, if I could just add one thing, you mentioned an important nuance. Even if you're asking for help and the person or the group you're asking doesn't know the answer, there's another gem in that, and that is the following. We're much better at iterating towards a new solution when we do it together. Collaboration of people who are committed and hardworking and honest and ethical is the way to come up with novel solutions. So that's another thing that I really love doing is gathering people around who are aligned with the mission, the vision, the values. I'm convinced that when you put people in the room and put a problem on a whiteboard and you're surrounded by people who are committed to figuring out a path forward, that those are the situations that lead to brilliant breakthroughs in humanity. And we saw that through COVID. We saw it after COVID. And I'm sure in some of the topics we'll be speaking about here today, whether it's personal care or finances, that's, I fundamentally believe, the way forward as well. Collaborating with those who are aligned with you.
Absolutely. Again, that team aspect, that's what it's all about. Like we're not going to go throughout this life just being alone. I mean, some people will, and that just says what's about them. They just feel like they can do it alone, independent, right? Independent mindset, and that's okay to have that, but also realize that we are social animals. We're going to need someone to help us in some aspect, in some way or form. So, in order to move forward in process, in order to move forward in a ever-changing environment, you're gonna need some type of team, some type of help, and you never know. So just having that team is very important. Um, I understand you started you eventually moved on to developing hospitals and medical practices and everything. I just want to say, what are some of the important um, aspects of starting uh, a a hospital or starting medical practice from scratch? What would you say some of the important um, strategies is in regards to that? And then we'll transition into your Titan Capital and what you guys do and what you guys provide.
Yeah. So I think that I've thought a lot about how one de-risks and uh, ensures success or optimizes success of any venture. And this applies to hospitals, it applies to new businesses, it applies to life in so many ways. And here's what I personally have boiled it down to in terms of my life. Number one is aligning with the visionary. So again, it goes back to the vision. What do you want to create? What do you want to achieve? And write it down, figure it out. Number two, it's got to address an important gap, whether it's a gap in healthcare, finances, personal development, whatever it is, there's got to be a gap. It can't just be a marginal value add. Number three is you need, as we said earlier, but I really want to reiterate, you need people to help you get there. You need a group, a tribe to help you get to where you're going. So in healthcare, let's talk a little bit about that. Starting a brand new academic medical center on the other side of the globe, 8,000 miles from a parent organization, purpose designed and built to emulate the home campus 100 years old. So there was a visionary. There were two visionaries involved: the leadership of the UAE, and the leader of the Cleveland Clinic, Toby Cosgrove. So they co-created a remarkable vision to deliver a complex and critical care that duplicated that which is available at the headquarters of the Cleveland Clinic in Cleveland, Ohio, and preventing people from having to travel thousands of miles away when they got ill, and training the next generations of caregivers and ensuring it was sustainable. That was the vision. That was a vision that never before had been established. People now look at it and say, "Oh, of course." But truly, it was groundbreaking and pioneering. Number two, there was a need. I mean, as I alluded to just now, people were having to leave home on and fly 15, 18 hours, 20 hours just to receive life-saving medical care. And it wasn't just them, it was their families and friends, and they would have to go with them. And it just seemed really unnecessary for a country that was aiming to be and is in so many ways a truly visionary and leading country in the world. But healthcare was lacking. So there was a true need on a tactical level. And number three, important stakeholders were necessary to de-risk it and to ensure its success. So our stakeholder on the sovereign wealth side was Mubadala. Just for context, hundreds of billions of dollars under asset management. And us as healthcare leaders reported right to the top. And that was a level of rigor and scrutiny and empowerment that we just had never been exposed to in US healthcare before. So, but importantly, we couldn't have done it without them. And as they shared, they couldn't do it without us. And it was really a beautiful synergy that we truly respect each other as we accomplish something. So a vision, a real important need to fill a gap, and key critical collaborators and stakeholders are going to help you get there. So that's the story in starting anything of substance in healthcare. You could make the analogy in the US, right? You need a visionary. You can't go into, sort of red ocean areas where everyone's competing over small marginal increments. That's not going to really set up a new endeavor for success. And then if you're doing it alone and you don't have the right channel or collaborative partners, you're not going to be successful. But let's turn our attention to what would be successful. picking a part of the US where or a part of the world where there's a vision to create something that's unique. It's going to address an important need, and you have the right partners to get there. Now, that's not only true in medicine, it's true in education, which is related to medicine. It's true in innovation, where we're creating new things that are practically applied. And in medicine, they're typically drugs, devices, diagnostics, and digital. And then it also applies in businesses. I'm sure we'll talk a little bit about that in terms of why we're investing in a business like Titan 3 Capital, which is committed to building communities worth living and creating legacies worth leaving. The same thing. Our thesis is unique there, and we're really blessed and to be collaborating with remarkable partners to get us to where we want to go.
That's exactly where we're going to transition into. So I'm glad you ended it like that. But so we transition from creating these medical practices and these facilities. I wanted you to go ahead and talk about Titan Capital and how they're developing things in the Northeast and what it is that you see in that market and why you started to. You kind of shared a little bit at the beginning on why you are uh, in this specific area, in this specific niche, and why you're looking to develop in real estate. But I want you to just expound upon it a little bit more. So Titan Capital is where they're at now in regards to the multifamily projects.
Thank you. To understand the transition of a heart surgeon and a leader transitioning to focusing on helping others build communities and building a future through real estate investments takes looking at our emergence from COVID. So it became very clear as we saw people thrive and people not survive through COVID, including caregivers. There were four things that some people did well at and some people did not. And they're as follows. It became clear that focusing on physical, mental, emotional, and spiritual aspects of our being was important to not only do good in the world and in medicine, but also to continue to be in the game. So, very simply speaking, we as caregivers in medicine, whether you're a nurse or a doctor or a therapist or even an administrator, we just don't take great care of ourselves. Yet we expect others to follow the advice that we're giving them.
Mm.
The same is true of our sort of cognitive or mental well-being. The levels of burnout, stress, and mental illness in all forms rose catastrophically during COVID. And as a healthcare leader, I was called to address those matters in our caregivers across the globe. And they were very eye-opening and challenging to deal with. And it made me realize that we just weren't taking care of ourselves or each other through the process. Spiritual doesn't have to be religious. It can be just really being mindful of a higher calling and a higher purpose. And that ultimately, once the cases are done and the money is accounted for, that's really what drives us, is a spiritual purpose and a sense of belonging and meaning for what we're doing. And then the emotional is just the relationships we're building. The relationships we're building with our colleagues, our communities in medicine, and our communities that we live in. So physical, mental, emotional, and spiritual. One thing that's foundational to all of it, and we see it if you don't have, we say no money, no mission. In healthcare, as you're seeing, hospitals are failing because they're not able, many reasons, but one of the reasons is they're just operating on razor thin margins. And even though they're saving lives and doing great things in community, if there's not the right financial stewardship, they don't exist to make a difference.
Mm.
The same is true of us. If we don't have the financial sustainability in our own personal businesses to continue to do good and do well and contribute to the world, then not only are we not going to be effective now, but we're not going to be effective in the future. And therefore, it made me think, what can we do as caregivers of people and people who are interested in advancing medicine? Not only if you're in medicine, but if you're in some related field, whether it's the finances around medicine or science or the infrastructure around medical communities. What can we do to build communities that are going to support academic medical centers? And therefore, we evolved into thinking that if we can build housing for caregivers around these medical centers so that we can empower them to do good for longer and take care of themselves and their family, that was going to be a worthy aim. Now, let me just stop there. That may seem logical for those of you from a business background, but I can tell you, coming from a medical background, they're usually incongruent. And that is because in medicine, we're not taught these things typically. Most medical schools don't teach financial stewardship or the ability to think about ecosystems that are going to help with sustainability. And that's really how we stumbled into this partnership. There's three of us physicians at Titan 3 Capital that had a very similar appreciation of the financial underpinnings of these four modalities of wellness and sustainability and physical, mental, emotional, and spiritual, and the fact that we had to develop robust communities supporting these things and the financial systems to help them be sustainable for long term. And therefore, we came together to create a company. We thought long and hard about what we wanted to involve ourselves in, and we came up with the following mission: is that we at Titan 3 Capital, three of us, and our partners are investing in communities worth living in to leave legacies worth leaving. And the legacies can be the communities themselves or the financial stewardship to help them continue on, be productive, be safe, meaningful places to live, work, and thrive for the caregivers and their families, and also create some financial sustainability for our families when we're gone.
Yeah, that's what it's all about. You want to ensure that that legacy is built for your family, and then for those that are around you, those passive investors as well that want to invest in those uh, projects that you guys have. So they'll and you guys are focusing in the northeast of the United States, correct? I just want to make
Well,
clear.
yeah, so initially, yes, and the following
Okay.
reason,
Mm.
Sunil, is that we learn in any business or certainly in medicine that we to do great things, you have to start with accomplishing something. So the goal isn't just planning, planning, planning. The goal is to plan, to de-risk, and then deliver, to execute on the plan. And therefore, we're starting around two thesis areas in Philadelphia, where I am currently at Jefferson, around the biotech corridor, one of the hottest cell therapy, immunotherapy, and innovation corridors in the US, if not the world, focusing on communities around that ecosystem and also in Boston around Harvard, MIT, and the other Boston schools to really develop this thesis of building multifamily communities that are supporting our academic, medical, and scientific efforts.
I think that's kind of that's not kind of the same thing. That is the same thing that Dr. Sanjay came on about a month ago, and he shared what you guys doing at Titan Capital, and he shared his story as well, and shared what you guys are doing, and it was very eye opening to a lot of individuals, including myself, and it just that type of market, I can see there's unlimited potential in that type of market. So incredible story, incredible background, and good research on you on your team to tap into a typically an unmarked market uh, for a lot of investors. So I think that's uh, a great way to, again, you strategize, you visualize it, and you're now in the execution phase of your plan. So kudos to you and your team. But I know we're getting close to time. I would love to dive deeper and talk about innovation and all these other things that I had a slew of questions for you, but it's okay. I think we got the gist of who you are, what you guys do, what you do, and your story, and the legacy that you're continuing to build upon. So again, Dr. Rakesh, thank you for coming on today. But before we close out, I just want to give the audience members any final thoughts, and then after those final thoughts, just share how people can connect with you and connect with your team.
Yeah, thank you. So there's a couple nuances I'd like to remind people of is that, many of us in medical fields and other fields as well outside of medicine don't do things that they know they would like to do or think they might like to do because of a lack of education. Therefore, one of our commitments at Titan 3 Capital is not just for investing, but also education. We want everyone's level of knowledge of building communities, investing in real estate that has an impact and growing in a sustainable way to be available to everyone. And therefore, what you can watch out for and look out for on our website and our subsequent mailings are opportunities for self-education for you, your partners, and your families, your children even, so that this knowledge gap can go away and we can all understand things the same way. And then the second thing to just remember about what projects we commit to is they all have to be projects of meaning near academic medical centers. But there are three things that are unique about it. Number one, any project we take on will be heavily de-risked, meaning we do the due diligence just like we do in the cardiac surgical operating rooms or writing a scientific paper. We do the underwriting with experts and ensure that we're not over engineering a deal, but we're actually writing it very conservatively, just as we would be in treating a human being. And that's a really good bar for being a conservative and a realistic predictor of what a deal will deliver. The second thing is that is that these are returns that are comparable to any other part of the market that is a solid investment. And again, we're not taught this in medical school. We're taught to just give our finances over to a financial advisor and just sit back and passively await the stock market going up. And we can see that that's just not always the case with rate changes and unpredictable things. It's not as tangible as real estate that's solid and growing alongside hundreds of year old organizations. And the third is we didn't understand as physicians, but now we do, and we teach about this. There are important tax benefits. Doing so in a tax appropriate way, following a tax code, allows us to grow personal wealth in for our families in a tax efficient way. So heavily de-risked deals, solid returns in a tax efficient way, all of which supports the longevity of communities that matter. So we'll help educate you. Please reach out. My email, I'm sure you'll include it with this podcast, rakesh.m.suri@gmail.com. And we'll also give you our website where you can sign up for our webinars, and we'll keep you posted and invite you to all of the educational opportunities moving forward.
Awesome, 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 awesome. We'll definitely include that in the show notes. Dr. Rakesh, thank you. It's been incredible. Again, you have a wonderful story. I really enjoy your background. I really enjoyed this conversation. I'm sure the audience members will too. And I just want to say thank you. Like I don't know how many lives you've saved, but I'm sure it's been you, numbers that I can't even count. But it's great to see that you're making the impact that you are in this world, and I'm glad you have the passion to do what you do. A lot of people don't have that, and they lose that passion and they lose that fire. But to see that the work that you've done, to see that you becoming the entrepreneur, the innovator that you are, the leader that you are, it's truly incredible. And I'm so glad to have you on, and I'm so glad to that you shared your story with us, with me, and I'm looking forward to having more conversations with you in the future.
Well, thank you, Arsenio, for creating the platform and the ecosystem to help messages like this and others that you've had on your show resonate around the world. So God bless you and thank you. And really, it's a privilege to be here today. So I appreciate it very much.
Same to you. Honor, honor, honor to have you on. Thank you again, and I'll see you around.
Take care.